Good morning. It is Tuesday, October 7th. I'm Lauren Prisbel.
And I'm Tim Ryan.
The Dallas Ebola patients now taking an experimental drug at Texas Health Presbyterian Hospital.
Dan is here to explain the latest.
And Tim, this upcoming week should tell us whether or not this one case of Ebola in Dallas has spread to other people. The patient, Thomas Duncan, a Liberian national, remains in critical condition at Presbyterian Hospital in North Dallas. He's being given an experimental drug called benzidofovir. The medication was developed by a North Carolina company. He is the first person with Ebola to receive this drug. Authorities are keeping a close eye, meanwhile, on 48 other people who came into contact with Duncan. Doctors say if anyone else is sick with Ebola, they will begin to show symptoms in the next several days.
I think this is a very important week. We need to be prepared in Dallas for what could happen. So if one of the family members, God forbid, becomes ill, we need to be ready.
10 of the 48 people who came into contact with Duncan are considered high risk. That means they spent the most time with him before he went to the hospital. On October 19th, it'll be 3 weeks since anyone outside the hospital came into contact with Duncan. If they don't show symptoms by that date, they are medically considered in the clear. And we are getting word this morning the Reverend Jesse Jackson Sr. will arrive in Dallas in a few hours. He says he'll be meeting with about 100 local pastors to talk about Ebola. Says he also wants to organize a prayer vigil for Thomas Duncan and his family. Dan Godwin on Good Day.
Governor Rick Perry is calling on the federal government to stop Ebola at the borders.
Customs officials and Border Patrol agents at all points of entry should immediately be directed to conduct enhanced screening procedures. Those steps may be something as simple as taking their temperature. These much-needed screening procedures will also necessitate fully staffed, prepared quarantine stations.
Well, those plans to screen passengers may, in fact, be in the works. We're not going to see them anytime really soon.
Jenny's live at DFW Airport with more. Jenny?
Yeah, you know, what those new procedures are and when they could take effect, we just do not know. However, the president has come out and said that federal authorities are constantly reviewing those procedures and policies to figure out what, if anything, might need to be changed. So he says that basically we're working on it, but for right now, everything stays the same. President Obama says while the chance for an Ebola outbreak is extremely low in the U.S., his administration is working on additional screening protocols here and overseas. The president says while U.S. leaders are working to confront the Ebola crisis, some foreign countries aren't doing enough. So he says he plans to put some pressure on other foreign heads of states to make sure they're doing everything they can to join the effort.
We have learned some lessons, though, in terms of what happened in Dallas. We don't have a lot of margin for error. The procedures and protocols that are put in place must be followed.
Now, in terms of a quarantine station here at DFW, according to the CDC, there used to be what they call quarantine employees at our airport, but they were moved to the hub in Houston a few years ago. The CDC says quarantine officers, though, can be dispatched to DFW in a moment's notice, and we do have local folks trained in that capacity. But what if a passenger becomes sick on a plane? According to the Tarrant County Public Health Department, each airline has a medical assistance team on the ground. There are also isolation units at DFW Airport. But if you've flown in here recently from an Ebola-affected country, you know that your temperature is not taken when you arrive here. That is something that could possibly change, but at this point, that's how it stands right now. Reporting live at DFW Airport, Jenny Anchondo for Good Day.